I'm Dr. Mark Roberski. I'm a staff psychologist at University Counseling and Consulting Services at the University of Minnesota. I'd like to talk a little bit with you today about some of the kinds of psychological issues that people would need to keep in mind if they're going to be studying abroad. Moving to a new country can be very stressful, so try to anticipate what kinds of things might be difficult for you with making such a transition and how you can cope with those kinds of stressors in positive sorts of ways. See if you can meet some of the students that you're going to be studying with prior to departing from the United States, so that way you can feel like you have some sense of social connection already with people when you're there. If you are seeing a counselor or taking some sort of psychiatric medication, it really is essential for you to discuss a plan with them for managing your psychological issues before you leave the United States. Now, even though you may feel like everything is fine and that you've got all of these issues under control, sometimes the stress of moving to a new culture, learning a new language, being around people who have very different kinds of customs, that can aggravate already existing issues. So if you're on medications, don't stop taking them. If you're considering doing that, meet with a psychiatrist in the country that you will be in to discuss that. And just be aware that sometimes medications need to be adjusted to some degree when people come into a stressful environment, even though things have been under control prior to that. And then have a plan for how you're going to get more medications or get to see a psychiatrist or a counselor when you're in the new country, in case you decide that you need to do that. Now, the Learning Abroad Center staff can help you with that, and they can arrange to have information available for people that you can connect up with in the new country. Disclosing issues to them about problems having to do with eating disorders maybe, or difficulties controlling substance use, anxiety, clinical depression. These are the sorts of things that they can arrange for ahead of time and be able to be of greater assistance to you once you're actually in the new country.